Physical health is an enormous category, and it's different for every single person who's receiving care. It can be overwhelming, and that's the only thing that we'll think about. There's a couple of thinking hacks that might help us as we think about physical health. One is, do we think about the issues that are proactive health issues versus reactive health issues? What I mean by that is there will be things that arise that demand some reaction. So a health condition that arises that needs attention versus something that we can solve in advance almost preventively through practices of wellness like exercise, nutrition, and sleep. That's one good model to think about physical health. Another one is thinking about chronic conditions versus acute conditions. So chronic conditions are the ones that we need to figure out how to live with for the long haul and how to manage and stay within the right limits. And acute conditions are things that might be more of the reactive brand that arise that we could need to shift our care and approach with so that they could be figured out and healed and perhaps not last as long. We also need to be really thoughtful about what are the risks that I might need to really care about and what are the ones that I don't need to think about and may not be able to control. So we should be prepared to identify and understand some of the top risks and concerns like neurological disease and respiratory disease and cardiovascular disease. Those are likely going to surface at some point during the aging process. So those are things we should be aware of. Other things like med management and provider coordination. How do I think about all the people in the landscape of care that come into the physical health terrain and build relationships with doctors and clinics and my pharmacy benefit manager, however that is. There's so many pieces that we need to get our arms around, and they're all part of this slice of physical health.